Now, did you know that in Ghana, about 15 to 18,000 babies are born with sickle cell? That's quite alarming, and so there's a need for us to have a holistic conversation about sickle cell. My guest this morning is GHOne. She is the executive director for the Ghana Foundation for Sickle Gene Action. Good morning.
Good morning.
How are you doing?
I am
Good to
well,
have
thank
you.
you.
I'm doing well myself. We're managing. We're managers of the country, so we're managing. But let's understand sickle cell. There are a lot of misconceptions, myths concerning sickle cell. To the layman, what is sickle cell?
So, to the layman, and actually being a care provider myself, I will not speak in medical terms, but what I tell parents who have worked with sickle cell disease is that, sickle cell, as we explained it, is a blood disease that comes about when a person inherits two abnormal genes from their parents. So the misconception about maybe, they only got it from one side and not the other, it's not necessarily true, although it could, very well contribute. So once you acquire those genes, and it could either be SS, SC, SF, S beta, tau beta. If once you contract any of those genes, then you have sickle cell disease.
Okay.
So when you realize that you have sickle cell disease, is that you have to go through. There's a test called the electrophoresis test, HB electrophoresis test. So when that is conducted, it will tell you the genes you have, which would then conclude that you have sickle cell disease. When you have it, normally the first 6 months of a child's life, they still have some blood from the mother, so we don't necessarily see a lot of symptoms. But once that wears out, then we start seeing the child starts experiencing symptoms of the illness. It's a lifelong illness.
Unfortunately.
Unfortunately, and the symptoms vary in so many regards. We even call it the silent illness, because sometimes you may not necessarily see the damage that it's actually impacting the person's life until it's too late. So from anemia to pain crisis, any part of the body where there's bone, there can be a pain crisis, to acute chest syndrome, which is, an infection that happens in your chest area. Sometimes you have leg sores. Sometimes you have, issues with your spleen, because the spleen purifies the blood, and because the sickling blood gets stuck to the spleen a lot, it's not able to purify it effectively, and so the spleen has to work overtime, and with that it weakens it. So sometimes you have issues with your spleen that can also affect your liver, your kidneys.
So it means it comes with a lot of complications.
It does. It does.
And how do I know that I have sickle cell? For a parent who has a child with sickle cell, is it always the case that a parent must have the sickling before a child gets it, or there are cases where no traces from both parents, but you have a sickling child?
Not necessarily, because you only get it by acquiring abnormal genes
so
from your parents.
It's genetic.
It is. It is. That is why it's important, especially when we come to genetic counseling, to ensure that people know and understand the extent of the illness, so that when you're choosing your partner, you know that you have somebody that compatibility matters when it comes to your genotype. But then, the good thing, as we're talking, you'll find that the good thing is that now there are treatment options for people who may have it and would want to have children. There are fertility treatments that have.
So it is preventable now.
It's in a way, from what I understand,
so
it's preventable
is
from passing it on to your offspring through some kind of fertility treatment and options that are available. So science is moving forward.
In the past, when you know somebody who has sickle cell, you consider them a walking dead. Today, science has evolved.
Yes.
Would you still call or consider somebody who has sickle cell a walking dead?
Absolutely not. Absolutely. As a matter of fact, they used to be called sickless. Now,
Yes.
Now that is a no-no word. That is an abomination. You don't call anybody a sickler. That means you're colo. Right now, you say a sickle cell warrior because they are, they are fighting the most incredible battle there is to fight, and they are doing a great job fighting the battle. Right now, there are treatment options that are available. We have the guidelines for treatments, which was established. A good mentor of mine, Professor Kwekwohene Frimpong, who used to head the Sickle Cell Foundation of Ghana, he was very instrumental in helping establish these guidelines for treatment. And basically, what those are, evidence-based steps that any practitioner provider can follow to manage and help somebody with sickle cell, treat them so that they can have less crisis, but they can have a more fulfilling quality of life. So there's this revolutionary medication called hydroxyurea.
Okay.
And it's a brilliant medication because studies have shown, and we have actually testified, those of us in the sickle cell community have testified that it actually does wonders for anybody with sickle cell disease. It decreases their symptoms significantly to the point where if you were going to the hospital for crisis-related matters, maybe 10 times a year or 20 times a year, some people are not even going to the hospital at all.
Wow.
So it's that, it's that big of a deal. And then there are other sort of preventative measures and treatment therapies and guidelines that people have to follow. There's what we call the transcranial Doppler. It's a detection for detecting signs of stroke. Now, anybody with sickle cell as early as 2 years old can suffer a stroke. So these tests are important.
Yeah.
Yes.
That's quite deadly. For a 2-year-old?
Yes.
Wow.
Yes, you should go to Kolibu right now and see the children who have, who have suffered stroke as a result of having sickle cell disease. So there's a test that can be done, and so it's done routinely to follow a person to ensure that they are not, showing any signs of stroke. Your diet is also one of the things, but also knowing and understanding what your triggers are so that you can manage that situation. And then also ensuring that you are working with your treatment providers, your doctors, you're attending sickle cell clinics routinely so that they can continue to monitor you. Because when you're, specifically with regards to the medication I was talking about, the hydroxyurea, if you're taking that medication, you have to be followed and monitored by a doctor closely, and that requires routine lab work and blood tests that are done to ensure that your levels are okay. So with that, you have to ensure that you're going to the hospital regularly, routinely. Sometimes your doctors might not even want to see you for months. They'll say come once every 3 months because you're doing so well on the medication, but we still need to monitor you and make sure you're taking it regularly. The good thing about Ghana right now is that hydroxyurea is currently on NHIS.
Okay.
So if you have NHIS, and so we actually encourage people to enroll into NHIS because it helps. If you have NHIS and you're going to any of our district hospitals that run sickle cell clinics, you have access to the medication from the pharmacy within that hospital setting. So that is the benefit of the medication as it is, and what NHIS has been able to do to ensure that people with sickle cell disease.
Would you say education is enough, especially for those in the rural areas, to know that the world has evolved, and so science has also evolved? So there's option available for them, because once somebody has sickle cell, they deem them to have a shorter lifespan. Is this still the case? Do people who have sickle cell have shorter lifespan?
No, they don't. People can live up to 70, 80, some 90 and beyond. So absolutely not. And that is because of the revolutionary treatment and medication options that are available right now. Education matters, and that is why the Sickle Gene Action is here to raise awareness, but also empower patients about the illness, about their options, but also to keep them apprised of new innovative therapies that are coming that they could take advantage of. I was recently in Upper West Region, and as well as Tamale. And yes, I can tell you that education and awareness is very important because following my awareness and education session, the number of calls and people that reach out wanting to know more, wanting to know how they can get help, which medical facility to seek help in, was actually quite impressive, I would say, which means that people know that this illness is there, but for some people, they don't know how to access treatment,
Yeah, yeah.
or just know, or their knowledge of it is limited. And so it was helpful for them to learn about the illness extensively. So yes, education does matter a great deal.
Let's look at what your foundation is doing. How long has the foundation been in existence?
Well, for me as a caregiver, I've been in this journey for 16 years now.
Wow.
And so for me, it started off with my child and us relocating to Ghana 5 years ago. And so that's when I got connected to all these lovely people, Professor Kwekwa Hidefrimpong, Dr. Brew at Ridge Hospital, Dinah Bedu, and a few others. And at Ridge Hospital, because that was the primary hospital that I was accessing, we were able to mobilize ourselves and form the Sickle Cell Association of Greater Accra Regional Hospital, which is Ridge Hospital. And so that is where my work in advocacy actually really started. And so with that, we have a very vibrant patient association group at Ridge. And from that experience, I thought that there was a need to move it into a more national focus. And that is where Sickle Gene Action was birthed. And so with that, obviously I got some very good mentor, which was Professor Kwekwa Hidefrimpong. And some of the key aspects of the treatment that he had laid out in his 30 years of work, we just, which is beneficial to us because we know we've experienced it. I just thought there was a need to build up on it. So we're taking everything that he's already laid out, the foundation he's laid out, and we are building on it as an organization. And so with that, we're going into hospitals, we're going into schools, we're going into all the 16 regions of Ghana to educate people, to do screenings for children who may not necessarily know that they have sickle cell disease, because there is that bit too, where even though we have a newborn screening program in Ghana, it hasn't been scaled up where it's nationally being conducted. So there's some kids who maybe might have survived, they have it, they don't know it, might have survived it till now. So when we call them the catch-up testing group. So we test them in the schools, and if they have it, then we give them the resources they need to follow through with providers within their locality. So we're doing that too. We're speaking to our Islamic community, we're speaking to our traditional leaders, everybody across the board, because it affects all of us.
Going around the 16 regions, were there certain misconceptions that you thought this should have been demystified a long time ago?
Oh, yes. Oh, yes. The fact that people think that if a child has sickle cell disease, the child is from the devil, that is one big one, or it's cursed. And sometimes, one parent will think that the child is suffering or is always sick because of the other parents and would blame the other parents. I would tell you that there are numerous situations where, as a result of a child having sickle cell disease, the parents have had to divorce because there were so many problems, and it was because they weren't really understanding, how the disease came about, which is from both parents. It's never one parent; it's often from both parents. And the fact that this is something that they just needed to learn more about, increase their awareness, and know how to manage it. If you know how to manage it, you can live a fulfilling life. Your child will be okay and would live as long as God wants them to be on this earth.
So, for you as a parent with a ward with sickling, what were some of the most challenging moments for you?
I think, initially not really understanding the illness, obviously. So being like any other parent who didn't understand it, but also watching your child suffer, especially before hydroxyurea was introduced into the treatment options that we have currently. It was always a challenge because you were guaranteed that if the child goes swimming or they go to the beach and they get a little cold, you're bound to go to the hospital and would have to be admitted. Sometimes for 3 days, a week, sometimes you're in there for a month, maybe longer.
And you're in a cold region?
Yes, unfortunately. So you had to deal with all of these situations. However, and what, I understood in working with parents and children with sickle cell disease is that when they're going through the pain, it's so excruciating that I believe I'd asked one of the children to describe it to me. And the way they described it, it stuck with me and has never left me. They said actually said two options. It feels like either a car is running over your arm, or a knife is being used into like you're cutting bone with a knife. So if you think of that, if you think of that
If you
image,
imagine.
yes, and the amount of pain that comes from it, and you see a child suffering,
Imagine chopping vegetables and you slit your wrist.
just that alone
Yeah,
is
yeah.
painful enough. Yes. So if you think about that, then you get to understand why, what pain is like for a person dealing with sickle cell disease. And so for me, I start looking at compassion in even our healthcare system. How are, providers treating people with sickle cell disease who go to the hospital and say, I'm in pain? Because the pain they are experiencing is quite excruciating. But if you don't understand it, you wouldn't know how to treat the person, and you wouldn't know how much compassion to actually give the person in that situation. So yeah, it's the pain. It's the pain, and for from going to having to be in the hospital for extended periods of time, and now thankfully just having to go in and out, or maybe do an appointment here and there. It's been a blessing.
What are the known causes of known symptoms of sickle cell? So, if I am a parent, what do I need to look out for? Or there are certain things that anybody at all should look out for when they experience it, then they can know that, oh, these are possible signs of sickle cell, so I need to seek treatment.
Well, for every person, your makeup is different, so it's individualized in terms of what causes you pain, what your triggers are, and so understanding what those triggers are. For somebody, just walking into a cold room alone can trigger them into crisis. So understanding that and knowing that in that case, maybe I need to bring a sweater or something when I'm going to a cold area, then you do that. For some people, one of the things, the general rule of thumb is that you have to drink lots of water throughout the day, every single day, lots of water, because it helps with the blood flow and getting things moving in your system. And so it's very key. We really, really encourage people to drink a lot of water and be well hydrated. So you definitely want to do that. But beyond that, the yellowing of the eyes, the jaundice.
Is it still very common?
Not right now, especially with the medication in place, because it takes care of all of those things.
Okay.
But sometimes, let's say maybe a child is not on the medication, or they aren't taking the medication consistently, then you might start seeing certain signs. If you run labs, you see that your H1B levels are low. That could also be an indication that you need to seek treatment. Or if the person's complaining of pain, or unusualness in the way they normally act, but also if they have temperature. One of the key things that I also introduce in Ghana, and I think most of our healthcare providers in the sickle cell community are doing a great job with that, is that usually when you go to the hospital, or before you go to the hospital, they'll say if you're in pain or if you have a temperature, it cannot go above a certain threshold. If the minute you get the threshold that you see, you have to run to the hospital immediately for care. So parents recognizing that is very important, but also listening to the child. Sometimes a child can have a simple toothache. If it becomes an infection, it could be life-threatening. Yes, so really, really listening to your child and working with the doctors that are helping you manage the illness, so that they can have that frequent flow of communication when it comes to your child's needs.
How fatal is sickle cell, and what's the fatality rate?
Life-threatening, death. So that is why we want people to know and understand that there are options to prolong your life, to decrease your crisis, so that you can live a fulfilling life. Because the more crisis you get, the weaker your organs get. Because with every crisis going in and out of the hospital, it's affecting one organ or the other. So if you know their treatment options, just like any other life-threatening illness, you're better able to take care of yourself. If you know there's a guideline for treatment that you can follow and do simple things to keep yourself and your body in its optimum best, then you know that you can prolong your life. We want people to understand that, but we also want people to know that if you have a crisis or if you have symptoms, don't wait. Make sure you seek help so that you can, because time is of essence. You need to make sure that if it's severe enough, you get to the hospital in time, so that if they have to maybe give you blood transfusion medication, whatever the case is, they can start that right away. So knowing that, which is, awareness and understanding the nature of it, you're better able to take care of yourself and prolong your life.
You mentioned blood transfusion. One of the things I realized was a number of them require constant blood transfusion.
Yes.
Why is that the case?
That because again, it's a blood illness, right? So the sickling blood breaks down very easily. Everybody, if you have what we call the normal blood, which is the blood that does not have any sickling in it, that can go up to 90 days before it breaks down. For somebody who has sickling blood, you're about 21 days. So that's your cycle. That's how quickly your blood breaks down.
So after every 21 days, you need new blood?
Well, no, you don't need new
okay.
blood. Your blood needs to replenish itself. Because blood carries oxygen and other things, parts, it kind of runs all throughout the body. So, but when you have the sickling trait, your blood doesn't work as the other blood that other people have, which can last up to 90 days or more. So knowing that, it means that for some people, especially if you're not on the hydroxyurea medication, because what the hydroxyurea medication does is to
is that
give
also
you,
on the NHI?
That is what is on the NHIS,
okay,
yes.
great.
So that is what prolongs your blood to be able to, stay, again, withstand for a longer period of time before it, renews and then replenishes itself. But if you don't have that and, you go into the hospital and you are severely anemic, you have to be given you have to be given blood transfusion. Sometimes they do that too because again, your blood levels are low, so they have to replenish you immediately before they can start treatment. Sometimes they do that to get, if there's a good amount of iron in your system because of the sickling of your blood. They'll have to maybe take out that blood and then replenish it with more of like a healthier blood so that you can...
So that will be like a dialysis, right?
It's called exchange transfusion, yes. It kind of works. The mechanism is similar to dialysis. But it's not something that you do frequently,
okay.
Although for some people, it's part of their treatment option because that's what they require.
Going around, you realize that we have a lot of empty blood banks. How do people with sickle cell manage?
Blood need is an issue that we have found it necessary to speak about. Thankfully, part of our World Sickle Cell Day activities is partnering with the International Sickle Cell Center with ISCC, and they are also in partnership with the National Blood Bank. So there's going to be a blood drive on the 15th, this Saturday, at Tang Palace. We're collecting blood. And also we want to encourage people to give blood, because when you give blood, then people with sickle cell disease can access blood when it's needed. We understand that there's often a challenge when it comes to availability of blood. So we do champion, blood drives and donations a lot. And for people who don't see the need to, if you give blood, you're saving somebody's life. It's as simple as that. If you're giving blood, you're saving somebody's life. So please do.
Is there enough funding for initiatives like this, persons living with sickle cell?
Not really. Not really. So we also ask that if anybody's interested in helping us, that they can donate to our cause. For us, Sickle Gene Action, we are on Instagram, we're on Facebook, but also through our website, sicklegeneactionghana.com. It's a good place to go and donate. We currently have a GoFundMe running to solicit funding, because one of the things we want to do this year is, as in addition to visiting all the 16 regions again, because we've been to a number of them, but we want to go back because there's a lot more work that needs to be done. We also want to sponsor at least 100 people with sickle cell disease with a medical bill for the year. So whatever that is, we want to be able to sponsor them, because what we found in going around the regions is that for some people, the barrier is money resource. They would go to the clinic, they will get prescribed medication, but they might not be able to afford it because maybe at the time, the one on NHIS is not readily available. So there are those issues that we have to face, or they have to go to the lab and get their labs run, or you have to go and do a transcranial Doppler test, which is quite an expensive test. It's almost like an ultrasound kind of test they do on the brain, and that costs a lot of money too. So those are the things that we're looking at. So we have a GoFundMe that is running GHOne Action GoFundMe page where people can donate. We also have our website is the best place to donate, which is sicklegeneactionghana.com. So if anybody wants to donate, we have options there, Momo, whatever the case is, and they can donate to the cause.
Sickle cell.
It is very expensive. It is very expensive. But what makes it affordable is being on, your medication treatment, implementing the treatment guidelines. That makes life so easy because if you're going into the hospital for admissions and you're paying, let's say, 2,000 every time you go for admission.
How many people can afford that?
Exactly. So now you're taking medication that's, if you had to pay for it out of pocket, maybe 300 cedis a month. Or if NHIS, you're getting the coverage, you're getting the medication for free, then it's free. Then you don't have to go to the hospital and you save yourself 2,000 cedis. And, the government, NHIS also saves money because they don't have to supplement the hospital bill that you incurred. So, yes.
For those of you who do this work, is it rewarding?
It's fulfilling when we know we can save lives. When we're going to the regions, some of the calls that come in, and even afterwards, the people that call our line just to share their stories, it's heartbreaking. Sometimes you find out a child was, tested through the newborn screening for sickle cell, but the parents didn't follow through. And so you go back to follow up with the child, and the child is dead. So you hear these stories a lot. And sometimes, lack of awareness, right? There was a farmer that called, and he didn't know that he and his wife were both SS. So all 3 children they've had, 2 of them have passed away due to complications. They didn't know. And so it was the 3rd one that they got to find out that they both were not able to, as long as they were going to continue to have children, the children were going to have sickle cell disease.
But you mentioned earlier that now science has evolved, so persons with SS can actually have children without SS.
They can. There are fertility options, IVF options. I understand, has advanced to that stage. But you do need to speak to somebody who's specialized in that field, so that they can actually take you through the process. It's not cheap either.
I asked if it's rewarding because, when you go to a number of these rural communities, they have entrenched perceptions about sickle cell. They think that alternative medicine is the way to go. Is alternative medicine the option for people who cannot afford certain medication?
Because sickle cell is quite a complicated illness, it is best to have, work with all your providers.
Okay.
So without understanding, what might be included in alternative medicine, I would say the person will need to speak to, the person treating them from alternative medicine needs to speak to the doctor, the medical doctor. So together they can determine what is best for the person with sickle cell disease. I know that the MOH has been, doing a lot of work around a national agenda for sickle cell disease. And one of the things that I experienced was that they brought together stakeholders in the sickle cell community. And in that meeting, there were people from alternative medicine and other groups of people that were there, which means that, some people have found benefit in alternative medicine, but we have to work together. So there has to be open communication across the board, because it's one illness that needs comprehensive approach. So you have to work with all of your doctors, and all your doctors need to be talking to each other to make sure that they're giving you the best care.
Okay. Oh, you're doing a great job.
Thank you.
And I hope that you get the support that you need.
Thank you.
So that's Awuchu Missy. She's the Executive Director for the Ghana Foundation for Sickle-Gene Action. I think that it's a conversation that doesn't need to stop now. We need to continuously talk about sickle cell so people can get the help that they need. That's it for Health Alert.